Hey, it's Wendy.
And it's Jess, and you're listening to the Food Heaven Podcast,
your online resource for delicious and nutritious living. For those of you who missed last month's episode, we did our part 1 on diabetes management. We spoke about what diabetes is, risk factors, signs and symptoms. We also went into what tests you can do to confirm your diagnosis and other things. And so this month, we're going to be getting into complications related to diabetes, how to cope if you are diagnosed with diabetes, medication use, and also lifestyle changes. There are many health complications that can occur with uncontrolled diabetes when your sugars are just off the charts. So, Margarette, can you talk about some of the complications that happen?
When we look at complications, unfortunately, when we think about the stigma attached with diabetes, we're remembering the amputations. You hear stories of, she had diabetes or he had diabetes and she lost her leg or he lost a limb and so forth. And unfortunately, when we see situations like that, that's due to uncontrolled diabetes. Having diabetes does not mean that you will automatically develop complications. It all depends upon the level of how well controlled the blood glucose levels are. So uncontrolled diabetes will lead to kidney disease. Yes, if you keep eating the fried chicken and the food,
and the donuts
and
drinking the soda
and having your bacon, egg, and cheese on a roll or white bread and
These
not giving up the mashed potatoes. Yes, with diabetes, you will definitely have a higher risk of developing diabetes or having to have that lemonade or the sweetened iced tea or the 32-ounce gulpy. You will definitely have a higher risk, a probability of developing complications such as kidney disease, eye disease, unfortunately, are two of the highest among uncontrolled diabetics. The risk of amputations definitely goes up. When we look upon our populations, glaucoma increases when we look at eye disease. Retinal macular degeneration definitely increases amongst folks who have diabetes, who have uncontrolled diabetes. Or even how long you have the diabetes, unfortunately, can determine how high or how low your risk factors are for developing kidney disease, eye disease, risk of complications, as well as a high risk of heart disease, unfortunately. So when we look at heart attack and stroke, the numbers are higher among those who have diabetes, unfortunately. But the key factor is getting it under control. Taking charge of your diabetes is really the key factor. And when we think about how we can control diabetes, we have to start with the diet, guys. There's no and, ifs, or buts. All of the recommendations start with managing it through diet, managing it through lifestyle, watching what the carbohydrates are in your diet, getting enough exercise, losing weight. Anywhere from a 7%, 9%, 10% weight loss will definitely have positive impacts on controlling insulin resistance or type 2 or prediabetes risk factors goes down with just losing that 7 to 10% weight loss. And then as well too, managing stress is vitally important. As stress goes up, our blood sugars goes up. Okay, it's not only high blood pressure that goes up with stress, but so many other things such as raising the blood sugars with stress. And then getting enough sleep. If you're not sleeping enough, your risk for elevated blood glucose levels goes up. The recommendation is that typically we need anywhere from 7 to 8 hours of sleep so that we can decrease the risk of not developing diseases such as diabetes. It's been found that those who work the graveyard shift, your overnighters, have higher risk factors for diabetes, cancer, and so many other diseases. So managing stress, managing our lifestyles in terms of sleeping enough, managing our diets, our nutritional outlook on life.
And Actually, I read this really interesting article about sleep and just, having either too little sleep or having too much sleep, having over 9 hours was also linked with a higher risk for diabetes. So it's really great that you touched on that. So Margarette, a lot of patients, upon finding out that they've been diagnosed with diabetes, they get sad, they're upset, depressed, and they feel hopeless. What would you tell listeners who share the same feelings?
I would definitely recommend following up with any kind of support system, whether it's through a psychiatrist, a psychologist, a therapist, a behavioral health person, social worker, reaching out to those in your community who have positive outlooks in terms of positive messages to you. That could be your church or the person in your religious organization. Reaching out to them and forming a network of those who can give you positive feedback and the ability to say, hey, listen, I have a problem. Can you help me, by listening and giving me positive reinforcement or in positive ways to help deal and overcome with problems. So definitely have to go out there and find that positive person.
Yes, get that support. Mental health is so important. And as
Absolutely.
Margarette mentioned, being stressed and depression as well, it affects your blood sugar levels. And having diabetes is not the end of the world. I mean, there's many people, like Margarette mentioned as well, that are living, healthy, long lives, and they have taken control of their diabetes and they're doing what they need to do, and they feel great. So there are options. It's not the end of the world. You can live a long and healthy life with diabetes. Okay, so now we're going to get into the good stuff, which is how to manage your diabetes and take care of yourself. So you have diabetes, there's many things you can do to get it under control. That way you have a decreased risk for complications, you feel good, and you're living your best life. So we'll go over 5 things. I'm going to start with nutrition. So we all know about carbohydrates, or at least I hope we all know. Carbohydrates have the most influence on your blood sugars. So it's good that you know what they are. And so having diabetes doesn't mean you have to cut them all out, but you do have to practice portion control, and we would recommend that you go for healthier carbs versus like the more refined versions. So healthy carb containing options include fruit, things like sweet potatoes and other tubers, beans, quinoa, brown rice, oatmeal, whole grains, all of that good stuff. What you want to cut down on or completely eliminate is things like white bread, white rice, refined pastas, the sodas, the pops, the chips.
Juice as well is a big factor. The sweetened drinks.
Yes.
Those hidden sugars can be lethal.
All the juices, like things, even if you're making your own juices at home and you're adding maple syrup or honey or any other sweetener, we don't recommend that you do too much of that, or it's best if you just eliminate it. Cakes, pastries, cookies, all of these things are going to bring your sugars up very quickly. So when you are incorporating carbohydrates into a meal, we usually go by the My Plate method, which means that half of your plate is going to be non-starchy vegetables. So by non-starchy vegetables, I mean collards, spinach, your dark leafy greens, Brussels sprouts, eggplant, okra, tomatoes are fine. We want to stay away from like the corn and the potatoes and the sweet peas as a vegetable, because I know especially within a lot of our Hispanic communities, corn is, it's a staple as a vegetable, and potatoes as well, but you really want to go for the non-starchy stuff. And then you can complement your plate. You can, add some protein in there. You can add, a little bit of brown rice. So we can talk about portions, but it's a little tricky because you want to individualize it as well. So it's like I don't know that I would tell everyone to just do half a cup of brown rice for dinner. It really varies, and you can work with a dietitian to come up with a plan that works for you. It's influenced by your activity levels, by your weight, your age. I mean, there's a lot of things to take into place. But one thing's for sure, we want you to get those non-starchy vegetables in. They're packed with nutrients that help with, if you have any other risk factors going on, like heart disease, which is very popular popular in people with diabetes. It helps with that. It just helps with everything, inflammation. So get those leafy greens in a nutshell. You also want to watch your sodium with the packaged foods. Usually they're high, like the canned foods, a lot of these frozen meals, a lot of the fast food spots. The food is packed with sodium, which puts you at a higher risk for hypertension and heart disease, which can worsen diabetes symptoms. And another thing when it comes to nutrition is, especially if you're overweight, you want to try to watch your portions. You want to be mindful of how much you're having, especially with the protein and the carbohydrate. The good thing about the non-starchy vegetables is that they fill you up. And so you should try to always have that in the plate so that you don't go bonkers on the other stuff. Always try to complement your plate with that. What else? There's fiber, which we all love. Fiber is great because it slows down carbohydrate digestion. It helps keep you regular. All unrefined plant-based foods should have fiber: fruits, vegetables, whole grains, seeds, nuts. And so for someone who's not eating a lot of fiber, try to up it gradually so you don't get discomfort. Make sure you're drinking enough water so that the fiber is actually pushing through. You can also add some boosters in there. By boosters, I mean like foods that give you like an extra boost of fiber, like flaxseed, chia, nuts. You can add these to your cereals or your smoothies for that extra dose. Let's talk about fruit a little bit, Margarette, because I know a lot of people with diabetes, they want to stay away from the fruit because they're like, it's sweet and it's just sugar. What do you think about that?
Mm-hmm. That's a really good point about the fruit, because oftentimes people will say, I don't eat carbohydrates, and then they're having a piece of fruit. So, and I always feel like you have to re-examine that, because you are having a carbohydrate. Our carbohydrates are sugars and starches and fiber. So those are your three main components. As Wendy talked about fiber, we got a great sense of the benefit of fiber. So fiber is really good for you. Definitely aim for it. That 25 grams per day or more is a recommendation. When we look at the other two types of carbohydrates, our sugars and our starches, fruits falls under the sugar category. It has fructose. So when you have fructose, or when we're looking at the sugars and the starches, your blood sugar will go up at a relatively rapid rate, more so than with proteins and fats. So by having fruits, excessive amounts of fruits, you run the risk of increasing your blood sugar levels. So as a rule, I tell my clients, listen, if you're having fruits, have it in between your meals, more as a snack. That way you don't bump up your total carbohydrates too much. And of course, fruits are always healthier than juice.
Yeah.
My recommendation is get rid of the juice, have a piece of fruit, because at least you're getting the vitamins, the minerals, and more importantly, the fiber that comes with fruit, as opposed to the lack of fiber in juice. And so as a rule, I say try to do 2 fruits per day, one in the morning, one in the middle of the day. Watch the portion size of the fruit. Don't go overboard and sit there with that 3 cups or half a fruit salad or half a watermelon that you're eating by yourself. That's way too much. If you look at about a cup, if your fruit is roughly the size of a cup, that's a good way to estimate a correct portion size. So if it looks like the size of a cup or a tennis ball, you're really doing, relatively well.
Yes, and then another good tip is if, your sugars are on the higher end, when you're self-monitoring, or if your A1C is a bit uncontrolled, maybe have half a fruit, and you can pair that with some nuts, or you can chop it in some plain yogurt. And, with these food like nuts and yogurt, they have protein, they have healthy fat, and so it'll kind of balance out the rate at which the sugar is going into your system. So that's something that you can do as well. And talking about fats, it's really important to include healthy fats fats on your plate. So nuts, like we just mentioned, seeds, nut butters, avocados are great. I'm actually wearing an avocado shirt right now. Fish, vegetable oils, you want to limit like the creams and the butters and the ice creams and the beef and the bacon.
And the chocolate.
Yes, and the chocolate. You don't want to have bars of chocolate. Having just 1 ounce is fine, and you should aim for the dark chocolate.
Unless it's dark chocolate, absolutely.
Which is
dark
rich in
chocolate.
antioxidants. Try to get that dark
Yes.
chocolate in.
Yes.
Yeah, so you just want to limit the fats because people with diabetes are at an increased risk for heart disease, like we mentioned. So this way you're reducing your risk for a heart attack or a stroke. So all of these dietary recommendations are not exclusive to people with diabetes. These are guidelines that we usually recommend to most people. It's just general healthy eating, which I always tell my patients, it's not like you're following a special diabetes diet. Really, we should all be doing this. Also important to note is that these recommendations are not set in stone. Like Margarette and I have mentioned in this episode, it's really important to individualize treatment. And so personal preference, economics, culture, health beliefs, activity levels, weight goals, all these things have to be considered when developing a meal plan. If you're very active, you might benefit from having more carbs as part of your diet. And if you have uncontrolled diabetes, tighter control might be needed. So these are, some of the many things that should be considered, and a dietitian can help you work through this. Margarette, can you talk about the importance of physical activity?
Great point. We look at the lifestyle changes that are needed to manage the diabetes, to help you take control of your diabetes. And, we've talked about the diet. Lifestyle as well includes physical activity. So getting out there, not being a couch potato, is one of the best things that you can do to help manage your diabetes. The recommendation is that, just 30 minutes a day, either walking, jogging, riding a bike, getting on a treadmill, getting on an elliptical. You can just, put on a pair of good walking shoes, which has good support, and hit the road. You don't have to wait until you get an expensive outfit or that $100 sneaker that, you see advertised. You don't need all of that to hit that 30 minutes a day. I even recommend for those who may have issues of being homebound, do armchair exercises as long as it's been okayed by your doctor. But walking around up and down around in an apartment can constitute 30 minutes. What you want to aim for is to try to have continuous movement, so that you're not saying, okay, I've done 5 minutes, that's it, blah, 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 I'm not doing anything else. Really try to push yourself to aim for that 30 minutes a day and maintain that continuous movement, so you really get a better impact of the health benefits. And if you can, if there's no issues and you've got that doctor's okay, try to push yourself a little bit when you do that 30 minutes or that 20 minutes twice a day. Try to give yourself a little bit of a nudge, and you say, all right, I'm going to walk at a little bit of a faster pace, so then that my heart rate speeds up a little bit more so than that average sedate walk. Or I try to do a little bit more of an incline. So instead of going for a flat surface, I try to find a little bit of a hill or a bigger hill, so that I push myself to do more work, so that my heart is beating a little bit faster, so that I push myself to exert myself more during that 30 minutes a day recommendation that's needed for physical activity. So if you can get that at least 30 minutes 5 days a week, if you can hit an hour 3 times a week, you're really managing and getting to goal.
Excellent. And also, being active helps with stress. Having a diabetes diagnosis can be very stressful. It can be very disheartening. And so getting that physical activity in, it boosts your endorphins, you're feeling good. Cortisol and other stress hormones, they spike your sugar. That's why we want to reduce stress. We want to exercise. We want to tap into the support network that Margarette spoke about. Meditation works well for me. I think you meditate too, right?
Mm-hmm. Absolutely, and yoga.
Yes, yoga, working out, deep breathing, like whatever helps you manage your stress, try to do that. Margarette, can you talk a little bit about medication adherence?
Medication is extremely important. We always start off with lifestyle, but you know what? There are times when lifestyle is not enough, and you have to be very realistic. I know oftentimes people will say, oh, I don't want to go on the medication. I'm not going back. I can do it through diet alone. There are times when the diabetes progresses to the point where, you know what, we really do have to step in and not only have lifestyle, because lifestyle is critical, but we now have to go that extra step and bring the medication in. That may be at the point where the diabetes has progressed and it's at a stage where we really cannot manage it just with lifestyle alone. So medication adherence is extremely important. There's a variety of medications that are available on the market now. Years ago, it used to be like maybe 1 or 2 classes of medications, but now we're looking at a variety of different ways of managing. We can use oral medications, which is in pill form or tablet form or capsule form, taken with, water by mouth. All of those are available on the market. We have injectable medications, which can be either once a week. They're similar to having to take via a needle as we would insulin, but they're not in the same class as insulin. That may be our GLP-1s, which is a class of medication that will help with managing diabetes. So you take that either once a week or it may need to be taken daily. And then from the oral medications, the injectable medications, we have our insulin medications as well, which have a variety of different types of insulins that are available. What we call our basal insulins, which may be needed to be taken once a day, or our pre-meal insulins, which are taken at some point before a meal to help control and manage the blood sugars around meal times. So don't feel that, if you go into the doctor, there's only going to be one choice that you have. There are a wide variety of choices, and it's really individualized.
And it's really important that you take your medication as indicated by your provider. If you feel like it's not working well for you, you're not feeling well, this is a very common complaint, especially when you're starting the medication. With some of these oral medications, you might get some GI upset, some bloating, so you don't feel so good in terms of like digestion. That's pretty normal. But if you see that it's ongoing, you're not feeling good, this medication might not be working for you, your sugars are dipping too low, or they're just still staying too high, you're making the lifestyle changes, work with your provider so that you adjust the medication, but don't adjust your dose yourself, which is something patients do all the time.
So what we're saying is don't self-medicate.
Yes.
And another important point about medications, and this ties into the importance of testing your blood sugars, the medications can be given based on where you have a particular problem with your blood glucose. Is your problem in the morning? And if so, there are medications that help with targeting the morning blood glucose. Are your problems after a meal? If so, then we can target medications that will help with post-meal blood sugars. Is your medication needed to cover daytime elevated blood glucose levels? And if so, then we can help with medication that provides you with amounts that will help with throughout the day. So there's a variety of medications that target different types of elevations in the blood glucose, and it's really important for you to bring that log in when you see your provider and say, hey, listen, you know what, my morning numbers is the problem, or my mealtime levels are elevated, and we can adjust the medications based on what's going on and really individualize it to fit the needs of what's going on with you, the patient.
Exactly. And so aside from taking your medication and working with your provider to adjust the medication as needed, it's really important that you come to your appointments.
Yes, very
This is
true.
a struggle that we have with
True.
our patients. We were just talking about this. It's so important that you know who your medical team is. You have your primary provider, you have a dietitian, Hopefully you have a diabetes educator available. You know your pharmacist. If needed, you go to your endocrinologist, podiatrist, ophthalmologist, all of these things, dentist,
The eye doctor.
okay, everything. The
Yes.
therapist, if you need that extra support as well. Having this team and having this support network is so important, and it helps with reducing the complications and having your blood sugars under control. So that was a lot of information. We're going to get into some questions now, because we had a lot of you guys send us questions, after we did the pre-diabetes episode. And so, Margarette, I'll shoot you some questions and you can give our listeners some answers. So the first one is, can you reverse type 2 diabetes?
That's a tough question. Can you reverse type 2 diabetes? What I tell everyone is that we can get your type 2 to the point where it's so well controlled that a person can actually come off of medication or actually reduce the amount of medication that they're on. And this, of course, starts off with lifestyle, managing the diet, increasing the exercise, and losing weight. There's a lot of good studies that have shown that with a certain percentage of weight loss, yes, you can actually get to the point where your diabetes is so well controlled that you can reduce or even eliminate medication. So it's all tied in with lifestyle changes and weight management. So can we reverse it? It's not really, it's a tough question.
It's tricky.
It's tricky because you know what? If you start putting the weight back on, guess what? The numbers start coming back. So we can't really reverse it, but we can get it to the point where it's almost as if you don't have it. But you've got to maintain those lifestyle changes, guys. You can't do it today and say, all right, I'm my numbers are great. I'm going to go out there and do what I want to do. You have to maintain those lifestyle changes.
Yes, and also as you get older, your body's not functioning the same. As you get older, your pancreas, which is the organ that makes the insulin, it's not going to function as well for a lot of people. And so you want to stay on top of your game, because you're gonna start getting older and your numbers might start creeping up. And so that's why we say with diabetes, it's a progressive condition. With age, it tends to progress, and so it is a really tricky question, but Margarette made a good point. You can get your numbers to where, they are within the normal range, but that you have been diagnosed, and so you have to be extra careful. The second question is, does everyone with type 2 diabetes end up on insulin?
Everyone with type 2 diabetes does not end up on insulin as well. It matters how well controlled and how well managed the diabetes is. But Wendy brought up a really good point. As the diabetes progresses, as age increases, which can increase the rate of how well the pancreas or the diabetes is going, or weight can increase insulin resistance. So all of those factors can increase if a person ends up on insulin or not. What we do find is that the longer you have diabetes, the higher the risk will be that you will end up on insulin. So a large percentage of folks who have type 2 diabetes do go on to having to need insulin. But once again, there's, that light at the end of the tunnel. It's all about the management. If we can, get the lifestyle really into play and working with managing your diabetes and taking control of your diabetes through lifestyle and medication, it can reduce that risk of having to go on to needing insulin or being on insulin.
Does everyone with type 2 diabetes need medication, oral, insulin, any medication?
And the answer again is no. Not everyone with type 2 does need to automatically be started on medication. We always try the lifestyle, diet, exercise, weight loss. All of those factors will help with reducing the need for having to go on to medication. And testing your blood sugars, the 4 cornerstones. lifestyle as well as managing blood glucose by finding out what your numbers are, getting to know your patterns, the patterns that are out there when you test your blood sugars. Am I high in the morning? Am I high after meals? And if so, what are the lifestyle changes that I need to do to correct those factors? So we can reduce the need or even eliminate medication by lifestyle management. But if the diabetes has progressed to the point where lifestyle is not enough, then guess what, guys? Don't prolong it. Don't say I'm going to wait and keep trying my shakes in the morning. You really need to control the diabetes. You don't want the complications that comes into play from having high blood glucose levels.
Yes, and that's totally okay. It doesn't mean that you're doing anything wrong, that you failed at managing your diabetes. Your body just might not be able to process carbohydrates as well as someone who doesn't, and that's okay to take medication if you need it. The last question we have for you, Margarette, can people with diabetes drink alcohol?
Good point, because you know what? We live in a social world, so a person with diabetes, I'm sure, has a social life. So it's an okay question to ask, because we want and expect people to go out there and have a social life. With caution is usually the answer when it comes to alcohol. If you're having alcohol, the straight drinks, such as the ones that are not mixed with fruity, tooty juices and syrups, will have less of an impact on your glucose levels than those fruity, tooty drinks. So if you have to order something, try to order something that is not loaded with juice or syrups or any of the concentrated carbohydrate mixes. So the recommendation, according to the American Diabetes Association, is that for guys, 2 drinks is fine, and for women, we really recommend caution and say 1 drink is enough. And if you are having something, try to do wine or light beer, which is always a better choice because the carb content is going to be less, as well as the calorie content is going to be less.
And that's 1 or 2 drinks per day, just to be clear. But that doesn't mean that you need to be drinking every day, guys. So, and if you don't drink during the week, on weekends, you don't need to stack up because you didn't drink during the week.
And the reason I say with caution is that if you are on certain medications that have a big sign that say no alcohol, you really have to be careful, because if you're taking a medication that's required around a mealtime, say around a dinner or a time where you're having a drink, there is a big no-no with alcohol and medication. So be very, very careful.
Margarette, thank you so much for all of your insight and your knowledge. Margarette is absolutely amazing, and I'm so grateful to have her as a coworker. She's such a great resource. Thank you so much for being on our show. Heart you. So we'll make sure to post a transcript of this podcast on our website so you can read on all the things that we spoke about. Margaret, do you want to say anything?
Wendy, thank you so much for having me on your show as well. You're a great coworker to have. Wendy is a big foodie, so I always know who my resource is in terms of asking questions about what's right and what's not right. And she's given me a lot of great insights into what's going on in terms of meal planning and so forth. So thank you so much. And as well, too, it's a great topic because you know what? It's affecting so many of us.
Yes.
And, we really need the resources to get the diabetes under control and take charge of our diabetes. So thank you so much for having me and allowing me to share in the lives of so many people who have questions about diabetes.
Yes. All right. Thank you so much. And so with that, we'll wrap it up. We'll catch you guys next time. Take care of yourselves.